In vitro fertilization is a journey that is filled with hope for many. Sadly, for some, it's also a journey that is filled with heartbreak, very often, multiple times over. Many couples have suffered this heartbreak when the procedure just does not work for them. I'm doing this video to give you a better understanding as to why this procedure may not have worked for you. And naturally, when you know what may have gone wrong, you can discuss with your fertility specialist what are some of the things that could be addressed so that it doesn't happen again. Hi, I'm Dr. Kady, a board certified family clinician. Right here on HeyDoc, I talk about women's health, fertility medicine, and all pregnancy related topics. So if that's your thing or someone you know may benefit from the content I share on this channel, remember to share and to subscribe. And your likes also help many others to come across the content that we do right here on HeyDoc. There are many reasons why what I consider to be a great innovation in the scientific world, which is in vitro fertilization, may fail for you and may not have worked for you. And if you or someone you know has gone through this traumatic event of an unsuccessful IVF cycle, I sympathize with your loss. Okay, let's get into the reasons. The first is the woman's age. So we're going to consider age from two different angles. There is the angle that age affects the quality of the eggs that are produced, and there is also the angle whereby age affects the quantity of eggs that are produced. In one of the videos I did on this channel, I described the importance and the science behind egg quality when it comes to fertility medicine. A female child is born with all the eggs that she is ever going to have in her lifetime. Over time, the quality and the quantity of eggs that she produces decline. The reason the quality of the eggs decline with time is because these eggs, remember, have been there right from the start. And with every cycle, a couple of these eggs are going to go through the maturation process in order for one, sometimes possibly two eggs to be released during ovulation. Now, remember, these eggs would have been in those ovaries waiting to go through that process for many years. And with time, there is a greater chance of a genetic error happening within those eggs that are found within those follicles that go through the maturation process. As a result, the older the woman is, the higher the chance of genetic or chromosomal abnormalities occurring within each egg that she has remaining in her ovaries. And if one of these eggs that contains the genetic error is fertilized by a sperm cell, that egg will have an increased risk of an implantation failure. In some cases, way before they get the chance to even implant, after fertilization, the egg will just die off because the genetic makeup of that fertilized egg is just not compatible with life. So the cluster of cells that we expect to see after fertilization has happened just does not develop. In some cases, the fertilized egg that contains the genetic error does manage to implant itself. However, there is a greater risk of miscarriages happening with this type of embryo. Older women typically produce fewer eggs during the IVF stimulation process. Now, remember, we've dealt with egg quality. We're now talking about egg quantity, because a girl child, as I previously mentioned, was born with all the eggs that she was going to have from the day she was born right through to menopause.